Hi, Dr. Bafai. Happy Friday evening.
Happy Friday.
So I know it's post-Valentine's Day, but lips are a hot topic these days. So as a woman or anyone with a nice set of lips, how do you make your lips look optimally pleasing?
Okay, so we've always talked about injectables with the lips. So obviously, there are makeup techniques with contouring. There's two kind of methods of injectables. There is Botox, so either botulinum toxin or ona botulinum toxin, and there's other types of Botox as well. So, but the general term I use is neurotoxins or Botox. So you can do something called a lip flip, where you can do tiny little droplets of injections of Botox on your upper lip. In case you have thin lips, so when you smile, your lip does not invert. I don't actually have any neurotoxin or Botox in my upper lip. Now, as far as other injectables, so steering away from makeup techniques and laser techniques, because laser will not help. You want the lips, what's perceived as beautiful is having a prominent cupid's bow and philtrum, but not on every single patient. There used to be a very trending word called a Russian lip technique, and it was to help evert the lip when you smile, and what they do is they go this way and they thread upwards so the lip comes outwards, versus the retrograde filling going this way and coming out. So Russian technique can be harsh on certain types of faces and can make you look older or possibly even a little bit masculine. It's not necessarily going to make the lips look soft. So generally speaking, you want to have a bit of a pout from the side, and you want to have symmetry from one side to the other, and not just when you're standing and have your mouth closed, but when you're smiling, you also have to check the symmetry. So generally speaking, and this is kind of old school, kind of not, the ratio for the upper to lower lip should be 2 to 3. So the lower lip should be slightly larger. Of course, there's exceptions to that. There's genetic exceptions to that, and also sometimes patient preferences. So for a while, when I used to do my own lip injections, I was doing the Russian technique, but it was coming out to look too harsh for the rest of my face. And in my opinion, it's not necessarily very youthful. So depending on the lips of the patient, you may need to direct the needle in a certain plane of the lip in order to, give it more of a cupid's bow or give it less of a cupid's bow, and kind of make it soft in the center and not too everted on the edge, which is what we call the trout pout or the duck lip. So it's very important to make sure that the lips match the rest of the face. And I think second to the eyes, the lips and the nose are the most important features of the face. So you have to kind of make it all fit together. I've seen a lot of women my age or older or slightly older on TV who have overdone their lips, and they do less filler in the rest of their face. And on some of them it looks attractive, and on others it looks a little unusual. So it's very important that the lips, just like when you go to the plastic surgeon and they tell you what kind of a nose fits your face, it's very important that the lips matches your face and matches, the age range that you are in. So I tend to go on the more natural side. I tend to do less of the trout pout where it kind of sticks out or ducks out, but symmetry is very important. So when you've gone to an injector, you should probably look at their lips and see if it looks good, if it looks natural, if it fits in. And second to that, they have to be very careful with their lifestyle. So you can't do lip filler and then go drink from a straw or kiss or drink from a straw for the first 3 days. You want everything to kind of settle in place. And then if any touch-ups or tweaks need to be done, in our office personally, we don't charge for those. But to me, symmetry is very important. No nodules, no lumps, no excessive scar tissue. Patients often ask me if I use a cannula. I don't use cannula technique for anything, and I have my specific reasons for that. But you want it to look natural. You get so the ways to get an eversion with your upper lip so it doesn't curl in is the lip flake technique, which is a couple units of Botox. It also helps with lines on your upper lip. And also the Russian technique is kind of starting to go out of vogue because it does look a little harsher and older. So a lot of times we do what we call retrograde filling, which is we go in with a needle, redirect the needle, the regular, not a cannula needle, redirect it within the, center of the lip to put droplets of filler in the lip. I tend to like Restylane Silk. It does bruise and swell a little bit more than some of the other fillers, but it gives me more control and it lasts a little longer than Juvederm, which can migrate.
Okay, perfect. Thank you so much for all the insight, Dr. Buffay. Have a good weekend, and we'll see you next week.
Oh, and lastly, it's always nice to match your fingernails to your lips.
Perfect. You look great, as always. Have a good weekend.
Have a good weekend.